and we really are back. We are here at the All Things Senior Expo here in the city of Scottsdale at the Performing Arts Center. We're right in downtown, so if you're in the area and you want to come down and check stuff out, feel free to swing by and run into people. Make sure you say hi to Kevin, who's the planner of this down there. But right now, what we've got in the hot seat and interviewing Katie McBee with McBee Medicare Company. Katie, talk to us about your business. What do you guys do?
So we sell Medicare Advantage, Medicare Supplement or Medicare Gap, prescription drug plans, dental plans, hospital indemnity plans. So Medicare, most people are eligible for Medicare Part A and B. Medicare Part A and B doesn't necessarily cover everything. So we help people find plans that are right for them, that will cover all those additional items and some extras that they wouldn't get with Part A and B.
Okay, and A and B is because a lot of times our audience, we kind of put off Medicare until we are faced to have to deal with it. So we hear mom and dad talking about Medicare. A and B are the parts that they're going to pick up naturally when they go to file Social Security, and then they do a separate filing for Medicare,
yes,
correct?
The majority of people are eligible for both, yes. So,
okay.
Yep.
And do you guys help with that original filing for the A and B stuff, or is that done before?
We can definitely help with that.
Okay,
yep.
So you can full stop shop.
Yes.
You can handle that when the Medicare question comes up.
Yep, call us.
Yeah. I love that. So you talk to those basic services there. When should a family call you? When should mom and dad be thinking about it? And if they weren't, when should a kid step up and say something?
So definitely starting around 64 for sure, start looking into it, understanding. We offer Medicare 101 classes. Yeah. And it's just a good idea to understand what the process is and kind of know the direction you might be going. Things are always changing, plans are always changing, but to kind of have that basic understanding of Medicare is great to start at least by 64. But definitely within 3 months of your 65th birthday.
Now that is an important date, right? Because that your like failure to register can cost you money forever. You
exactly.
Can make so real brief. Tell us about that. What do we need to know?
So you have your initial enrollment period is 3 months before your 65th birthday, and 3 months after. And if you don't sign up in that initial enrollment period, you're likely to get a penalty. Yeah. And again, that can cost you.
And that penalty
lasts you
every month.
Every month,
life,
exactly.
Right?
Yes, so you do not want to miss that period, and there are different enrollment periods for different people, depending on your situation. But the majority of people, that is the time that you want to be signing up. So if you've missed it, that's it happens, and still call us. We'll still help you. But definitely for the people that are not 65 yet, do not miss that period.
What's the top when you guys do get that call? What's the most common question that you guys get?
What do I do?
Well, yeah, that would make
so
sense.
For sure. And we're going to walk everyone through it. So we want them to first understand the process, because that's super important. We don't want you going in blind to anything. And we're going to do what's best for you, like for your parent, for you, whoever's calling us. I've never pushed anyone into a plan that they're not ready for, they don't want. I want to make sure I'm fulfilling all their needs and really giving them something they're comfortable with, and we'll do a great job for them. So.
Now, the stakes of this, are there some decisions that you make at that time that are permanent decisions that will, or can you make changes to
you
most
can,
of this
for the most of it, you can make changes. So if you go into, say, for example, a Medicare Advantage plan and you're not happy in that first year, next year we're going to look at it and we'll change it for you. And that goes for not only if you're not happy, but maybe something changes in your medical status, your health status. Yeah. And so those are important things. We actually do recommend looking at your plan every year during open enrollment, which is in October through December, that we look at it and make sure it's working for you.
And that's when people change lanes, if you will.
Yes,
that's,
most of the
which
time.
Which is pretty similar to employer. And I guess maybe the last question that we've seen out there a lot is mom and dad are going to work till they're 70, or mom's got a little bit of healthcare that sits out there, so we don't need to do anything about this, right? Do they need to do something about that?
So still call us. If you're still working at 65, still call us, because it depends what your company's plan is. It depends how many employees there are. So there's a lot of factors that play into that. You might not need anything, but you might, and you don't want to get penalized because
Now, and you still, even if you don't need anything, you still have to register and let the government know. Is that correct? That 6-month window around your 65th birthday, 3 months before, 3 months after, do you still need to make an election and let them know that you have insurance? Or
Yes,
yeah,
you'd still want to do that.
yeah.
So
that make sure. Let's make sure we stay away from the penalties. There's enough,
exactly.
Yeah, everybody loves to pay taxes,
exactly,
but not penalties.
exactly.
Well, I appreciate it. So, tell us, where can we learn more about you? How can our audience find you?
So I'm on Instagram and I'm on Facebook. It's McBee Medicare Co. So look me up, and my email is kate@mymedicarecentral.com.
That sounds great.
Yeah.
And that is McBee, 2 E's. Yep.
McBee, 2 E's.
Okay, great.
Yes.
Katie McBee, thank you so much for joining us
Thank
today.
you so
and good
much.
luck
It was
to
a
you and your
pleasure.
company. It's great
Yeah,
to have
nice
you.
meeting you.
Take care.
Thank you.
Thanks. And we'll be back in a second.